you, Bhavjit. So it's an honor to have my own presentation moderator today. Okay, thank you again to the organizing committee. It's an honor to present this, something a bit lighter, hopefully. So, my Cancer Family Building and Sustaining Cancer Community is just sharing our 20 years experience leading this group. Okay, more often than patient is not alone. Okay, thankfully, cancer patient, because they always comes with the families around them, and then the healthcare providers. Moving itself, or what? Okay, sorry. And this is the framework that we always understand. There's somebody around them, some agency, some bodies, even the societies. It doesn't move. Okay. So, but instead of like a single layer, simple, really interconnected, but I would rather feel that next patient should be look into a larger framework, which is more interconnected and more intricate relations in between them. So every patient, whoever decides something on them, will be affected. So it's not like a single. Even if the government changes the policy, it would affect patients themselves. Okay, this is the community. It should be defined this way. Next. So who is Max Family? We are a local support group for people living with chronic myeloid leukemia. We founded in 2006 by 10 people, comprises of 7 CML patients, a caregiver of one of the patients, a nurse and a volunteer. We successfully registered ourselves with the ROS in January 2009. Next. So throughout the years, we have managed to build our network ourselves. We have 6 chapters throughout the country. We have more than 50 patients meetings and camps, and we also run our physical. Other than the physical, we have our social medias to keep patients in the loop within our network. Okay. So why and how we started? We feel that there is a lot of gap in the access to the information, in particular CML. So working as a doctor myself with my background, when I was diagnosed in 2006, I was still working in the government. Honestly, I don't see that I have access to information, because being a doctor myself, I can just read and understand. But then, along the way, some of us feel that we should have. And I started to understand a lot of patients, it's not that they don't understand the disease, they don't know what to know. They don't know what to ask the doctors, other than the factors that the doctors are always busy looking at the situation in the government hospitals. So we feel that there is a lot of gap in the access of the information about patients' disease. Next. There's also a lot of gaps before a gap in the peer support when patients feel alone. They don't know other people who have been affected by the same disease. Next. So what is CML? It's a rare subtype of leukemia. It's actually one of the rare cancers. It's not listed in the top 10 cancers in Malaysia. But something unique about CML is that in the early millennials, with the advent of TKI, tyrosine kinase inhibitor, or one of the targeted molecular therapy in 2001, it changes or redefines the landscape of treatment. Before year 2000, there is no effective treatment for CML. They will go slowly worsen and die in the next 5 years. The only possible cure is bone marrow transplant, and it is not for everybody. So with the advent of these medications, it changes it turned almost fatal disease into a chronic and manageable disease. The catch is it's going to be a long life treatment, and survival, even though the survival almost similar to the normal population. And patient has to be, compliance and adherence to the treatment. And at least in Malaysia or in Asia, the average age affected with CML majority young and middle age. Next. So those are the fathers or either the mother of a child, the child themselves. These are people in a social level. They are, breadwinners, homemakers, students. They are productive workers because most of them are, around this age. Okay, next. And with a long life treatment, there's a lot of issues of adherence, compliance. They have to be constantly on these medications to stay in remission. The landmark study in 2001, after 10 years, 80% to 85% patients are still alive. Even though it's rare disease, the incidence, yes, 5 over 100,000, but the prevalence of this patient is getting increased over time. So, next. So, sorry, before that. So other than that is, with the long-term treatment, there's a short and long-term side effects issues, disease monitoring, because this patient has to be constantly monitored to prevent relapse or recurrence of family plannings and pregnancy, because all these patients are young patients, newlyweds, or going to have starting of families. Next. So what do we do with the mentioned challenges and issues? We managed to do a regular educational meetings. We get the doctors to come at one day and then call the patients to sit. So we realize that patients, when they are not in the clinical setting, when they are not in the hospitals, they are more free. They don't, really scared to ask questions. They even admit that they miss their medications compared when they see doctors in the, clinic setting. So these are the things that we managed to, get the patients to not to fear of. Next. And our group started to think about some advocacy and awareness. Next. And we also involved in some projects with the other NGOs to support collateral issues like Project Sambung Sekolah, those children who've been affected on their schoolings when their parents got leukemia. And also Max Transport Project to support some of the travel costs for them, at least for a small community for leukemia. Thanks. Next. So, getting started is very simple. Then we started to realize that we need to continue and sustain. It is an extra effort, resilience, persistence. I think this is a common challenge for any groups. Okay, next. So for the last 20 years, we have learned that no one else is more invested, more interested in running the support group. I have seen people come in and out who are not patients themselves. Probably there will be 1 or 2 people who are, continuing to support, but mainly the patient themselves. The key point is the patient themselves need to run or drive this effort. It's more effective in that way. Because our life experience usually offers insights and we have a level of empathy among ourselves, and everybody of us can speak in the same language with all the patients. They can understand it very well. And okay, before that, okay. So it also been certified by the healthcare workers around us, the doctors, the pharmacists. They feel that with the support group, they make some of their jobs easier. Right? So they don't have to spend a lot of time talking to the patients. Next. Nevertheless, yes, this is also a common challenge for any groups, maintaining a consistent manpower, because we understand that patients have their own medical problems, their well-being need to be taken care of, taking precedence to over organizations' responsibility, because they still have to, feed their children, they have to go to work. So, but we sometimes, or a lot of times, our groups understand each other and takes some flexibilities to run this group. Next. So we have also learned that if you're overwhelmed with some projects or some efforts, we go back to our focus. We make clear that our focus is to support educational and peer support. So in rainy days when we have no money, we have no time, then we go back to the most basic function of our group. Okay? And we started to learn some of our capabilities and our limitations. Okay, next. These are the things that we learned. Building a strong network, foster relationships with the stakeholders, start with the close one, immediate ones, the doctors, the nurses. They are the strongest supporters. We started small and gradually expand our circle. Okay, work together with them. Never work against, because they are the people who are helping us. So try to work together with them, invite them to the meetings, to whatever discussions. And sometimes they give us some insights into how to advocate. There's a few times that we have issues with the access programs, and they are the one who advocates on how to go through this. Get endorsement, okay, from the relevant professional bodies, and get recognition so that we can easily get visibility among our stakeholders. Next. Okay, next. We know that patient story is very powerful because it carries quite an impactful. It can inspire others to the listeners, and we think that patient story is a great product. Next. And we learned that we started to think about running a business. Our stories are great products, stakeholders, our clients, in good time we managed to sell the stories. So we just give them like a very cheap frame as a token. So we get them involved. This is how we. So stories are not sold, not for profit. It's really for a purpose, and it generates some hopes and change for those who need it most, who are the patients. Next. We also learned that we always instill among our groups to have appreciations and culture of giving back to the society. This is how a patient has benefits from whatever treatment that they get all this time, to give it back to society, do some good works, and encourage meaningful peer-to-peer. With the social media technologies, we have managed to connect everybody, through online and everything. And it's surprising, I just give you an example. A patient who has missed their medication, to take medication, and they don't have a supply, they just write in the group, anyone who has an extra pills. And the one that has an extra pills go to the patient that who needs it most while waiting for the next stop. So that's how the culture that we managed to build among our networks. Okay. So we always tell them support group is not for them, it's actually for the public, for themselves. Okay, next. yeah, we also learned that we need to build strong brands. This to make our image visible among the stakeholders and the community as a whole. Next. But we also learned that there are a lot more unmet needs, we don't have quality of life research. A lot of us still very reserved on telling the employer that they have leukemia. But knowing them that they are back to normal, as long as they're on treatment, they are almost like normal persons. You might not be able to differentiate between a CML patient and a normal person. And insurance, and this, I think, this is the universal problem. Okay, once you've been diagnosed with cancer, then that's it. Okay, next. So in short, we not only learn about creating support groups, but also building a support network. Okay, sustaining is about continue being passionate and about willingness to stand for our rights as a patient. And we are far from perfect, but it's not about perfection. It is about what works for us. So hopefully, with these little sharings for any groups that still struggling to maintain their groups, I hope that it gives some tips and advice. Thank you.